Recently, I received a question, and so I said I'll come online, and this is a better way to describe it. Now, clomiphene being taken and spotting still continues. Is clomiphene working? When does spotting stop? Spotting stops generally when estrogen levels start rising. And what causes estrogen levels to rise? Growth of follicles and the success of clomiphene. Why would somebody spot in a bit longer? And that's because the follicles have not yet started growing, and that is very common in polycystic ovaries. What you end up seeing is follicles not growing, and follicles are cyst-like areas that may contain eggs. And if it takes longer, you will continue to spot as long as an estrogen rise occurs, and that occurs as clomiphene becomes more successful. So what I would suggest is, if you continue to spot, by day 10, day 11, then have an ultrasound scan done, and that will give you an idea of whether clomiphene is working or not. Without that, it's very difficult to predict if clomiphene is working. Second, if your husband is going to be away during the fertile window, what do you do? Now again, that will depend on when the fertile window is in PCOS, because if you're giving clomiphene, you are going to start making eggs grow, or follicles grow rather. And then what ends up happening is you may ovulate at a later date. So my recommendation is get an ultrasound scan done by day 12, day 13. That will give you an estimate of when you will be ovulating. And you can use that to plan when your husband is going to be away, or also understand if clomiphene is working or not. Clomiphene does not work in about 25% of cases, and that is called clomiphene-resistant PCOS. And for that, what you would certainly think of doing is, if you're having irregular periods, only then you think of having myo-inositol taken, and that may help. And in some cases, metformin. But I think if you are uncertain, I feel it may be better to get an ultrasound scan done and see your doctor. Again, it's very important that we diagnose clomiphene resistance pretty early. Thank you.